somewhere between 2 and 6% of people that never took an opiate before come in and have surgery, end up addicted. That's not acceptable.
It is a crisis that continues to plague Ohio and the country. Opioids and overdoses. Now, one local hospital system is making drastic changes to attack the problem.
Summa has a goal: eliminate the use of opiates from all surgeries. Bob Jones live right now at Summa Akron City Hospital tonight. And Bob, doctors believe this new approach will save lives.
Hurrah, bottom line, doctors say getting rid of narcotics for surgery means fewer patients face the risk of possible addiction. In 2017, Summa used narcotics in 98% of its procedures. Today, that number is down to 20%. And by the end of the year, the goal is 10% or lower. She doesn't want her face shown, but her name is Nicole. She's 32 from Stowe. Her struggles with addiction started with pain pills about 10 years ago.
I would get them off the street and basically buy scripts off people.
Then she turned to heroin and overdosed, which left her temporarily paralyzed. Doctors prescribed her more pain pills. She was hooked again. The vicious cycle continued. Another overdose on carfentanil. She's been clean now for 2.5 years.
I basically have to take it one day at a time and work with others to keep my sobriety.
Dr. Thomas Mark, the chairman of anesthesia at Summa Health, says for thousands of others, addiction can start with just one dose of an opioid during surgery. Studies show that's up to 6% of patients.
That's unacceptable. We do, 20,000 cases here at Summa. That means that just because somebody had the audacity to have surgery, 450 people potentially face addiction.
Dr. Mark says narcotics are now only used in 20% of Summa surgeries, down from 98% less than 2 years ago.
For all types of cases. This is for our cardiac cases, for our neuro cases, for our general surgery cases.
Instead, he says, patients are receiving regional blocks with an anesthetic, a nerve block, or a combination of non-opioid medications, options that can provide non-addicting pain relief for days after surgery.
My goal is to eliminate the opiates from what we do here in the ORs. Completely.
Dr. Mark says he's also stressing to other doctors to cut down on the amount of pain pills prescribed post-surgery, a trend he believes must continue to reduce the number of tragic opioid overdoses. Nicole agrees.
People end up using them and abusing them and feel like they need them to function.
Dr. Mark says patient satisfaction is also much higher since the hospital started reducing the use of opioids during surgeries, and that patients are returning home much quicker. Live in Akron tonight, Bob Jones, News 5.